I start?
Yes, yes.
Yes, yes.
35-year-old male, software engineer by occupation, resident of Chhatrapati Sambhaji Nagar, examined by me on date of 1st May, presented with chief complaints of swelling in both right and left limb since 4 years. His patient was apparently all right 4 years back when he noticed swelling on both right and left forearm, which was insidious in onset, initially of size 1 into 1 centimeter, about pea size, and gradually progressed to current 4 into 4 centimeter size, nearly to a size of lemon. Currently, he have 3 to 4 swellings on both forearm of nearly the same size. This swelling was not associated with pain, not associated with discharge, no swelling anywhere else in the body, no significant family history, bound is discoloration of skin, ringing sensation in the ear, visual sensations, tingling sensation, or any paresthesias. No history of rapid increase in size of swelling, no history of significant weight loss, no history of anorexia and fever, not associated with any tingling sensation, not associated with edema. Patient had undergone a surgery for removal of one swelling on right forearm 2 years back. Patient had said that he had set the sample of swelling for biopsy and found out that the swelling was not carcinomatous.
Okay. Can from the history was just like over 4 years, huh? The
Yes, sir,
swelling
4 years.
is
4 years, sir.
it is there since 4 years. So it's from 1 centimeter, it has become 4 centimeter. That's what you say. It was a
Yes,
peanut
sir.
size and now it is the size of okay.
Yes.
Okay. So from history, what you think of possibility whether it's a benign swelling or a malignant swelling?
Sir, on history, I am suspecting it is a benign swelling.
Okay. Why you say it is benign?
Sir, because for negative history, I had ruled out some points like the patient was not having any significant weight loss. Patient was not having anorexia, fever. Sir, there was also no neurovascular invasion of that swelling, which says that there was no lymph node invasion, which can be seen through edema. There was no tingling sensation, which says that there was no nerve
Okay. No,
involvement
no,
of
these
that
are like
malignancy.
these are the points. These are the points on examination. So
Okay.
from history, na most of the swellings you classify into like inflammatory, traumatic, and neoplastic. Okay.
Okay. Yes, sir. So,
So
of course.
yes. So here it doesn't look like an inflammatory because the swelling is since 4 years. Correct.
Yes. Yes, sir.
And it doesn't look like even a traumatic also. There's no
Yes, sir.
history of trauma, and even a
Yes.
traumatic swelling, which like a hematoma or something, will subside.
Yes,
Correct.
sir. Yes, sir.
Now we call it as a like a neoplastic, l- likely to be, could be, we don't know. Okay,
Okay.
and
Okay.
but it's a very slow growing. Okay, over a four
Yes, sir.
years. So even
Yes.
if it turns out to neoplastic, it will be probably a benign. Okay, we won't be able to say
Yes.
much on history itself. Okay,
Okay.
yeah,
Yes.
fine. Yeah, can you go on look? Yeah, inspection.
Yes, sir. Local examination, inspection. Patient was examined in a well-lit room with prior consent. Swelling present on both sides of forearm, right as well as left. The right arm have three swellings and left hand have four swelling. Describing the largest one, which was present on the extensor aspect of forearm. Superior border of that swelling was 50 centimeter away from the wrist joint. Inferior border was 15 centimeter away from the elbow joint. Swelling was of size 4 into 4 centimeter, spherical in shape, well-defined margin seen, smooth surface, no redness, no discharge seen. A scar was seen 8 centimeter away from the flexor aspect of right forearm.
Can we see the swelling photograph?
Sir, this is
Okay,
the video of that swelling which I examined.
okay, acha, fine. Hmm. Okay.
palpation, no local rise of temperature, no tenderness. Findings of inspection were confirmed on palpation.
So,
The swelling
just
was,
Saurabh, just one
yes, sir.
correction. As you
Yes,
said,
sir.
like a swelling, can you go back to the inspection? You said
Yes,
it's a
sir. Yes.
swelling as well defined. Can you say that?
Yes, sir.
It's on inspection. You said like swelling is, it doesn't look well defined. It's a diffuse swelling. Okay. From that,
Okay, sir.
see, whenever when you call it as a well defined, na, you are able to see the extent of the swelling. If you are from the picture, what I am seeing, it looks like it's a diffuse one because
Okay,
you
sir.
are not able to see where the swelling is ending completely. Such swellings you exactly get na if the lipoma is on the scalp or on a forehead, okay, where it's a
Okay, sir.
complete bone. There is no much of a soft tissue. You'll know that okay that this is the swelling and this is a normal one. This is the extent, like this is the surface. This is the extent of the swelling. Here it looks like a diffuse. Okay, that
Okay,
one
sir.
common error which is done during during examination by especially for UG students. So here you need to make that the swelling is diffuse. Okay, it's not well
Okay, sir.
defined. Yeah, one thing. And you again a common mistake which is made is you say it as the swelling around you said is 4 by 4 centimeter.
4 into 4 centimeters.
So now see, like it's like on a even on a inspection on a palpation, you are getting the third dimension here. For all solid swellings, you need to
Yes, yes.
examine the third dimension also. Okay, on inspection you are able to see probably it's a 1 or 2 centimeter in height or thickness. Okay, that you
Okay.
need to mention, and you need to mention the size of the swelling right from like suppose from superior to inferior this much if it's a elongated swelling, from
Yes.
lateral to medius this much, and the thickness. Okay, of the swelling.
Okay.
Okay, so this is, and you need to exactly measure with the scale or a tape. Okay,
Yes.
again, a very common mistake which is done by the students is they overlook this as a size because sometimes you can go grossly wrong in the dimensions because sometimes you make it maybe 4 centimeter, actually it turns out to be 7 or 8 centimeters, almost double. Correct.
Okay, sir.
So,
Okay.
for all students who are now just hearing this, make during you are now going to face your exams. So always have a tape with you, torch with you, hammer with you. Okay. So because it's a question which is asked is, have you examined the swelling? How have you examined the dimensions? Many times it is copied because 2 or 4 or 5 students share the same case. So someone else has measured the dimensions. You can at least see that whether he is measuring it properly. If he has not measured, you should measure it again. Okay. So
Yes.
this is very common for a swelling. Okay, you can go on.
I just want to ask a question.
Yeah.
Sir,
Hmm?
in inspection, should we mention the thickness
Yeah, because you are
dimension?
able to see the elevation. Na? You are able
Okay.
to see the elevation of the swelling. Okay.
Okay, sir. Yes, sir.
Uh, because you are sometimes it's like a tip of iceberg. That's why inspection and palpation, the swelling you need to sometimes for especially or breast for abdomen, you will see the swelling as something very small for thickness. Okay, so you will see for a breast lump, you will see that is around 4 centimeter, but on a palpation, you'll come to know that it has occupied whole of the quadrant, whole of
Okay.
the side of a breast. Okay, it's like a tip of iceberg. Many of the swellings are sometimes like a tip of iceberg. That's why on inspection, the dimensions and on the palpation, dimensions may vary sometimes grossly. Okay. So just remember that tip of iceberg phenomenon for palpation. You will come to know. So you need to mention the even the third dimension on inspection itself.
Okay, sir.
Correct. Fine. You can go for like
Uh,
on palpation.
yes. No local rise of temperature, no tenderness. Findings of inspection were confirmed on palpation. The swelling was firm and lobulated in consistency. Skin over this swelling can be pinched. Pseudo fluctuation was positive. Slip sign was positive. No yielding of the swelling. There was no fixity to the underlying structure.
Now you are here, you are saying pseudo fluctuation. Instead of that, you can first then you make a diagnosis of a lipoma, and then you can say that is probably pseudo fluctuation. But initially, you should say the swelling is fluctuation or not there. है ना?
Okay,
Correct.
sir. Okay, sir. Yes, sir. Yes.
So how do you perform fluctuation?
Sir, fluctuation which we can do with two fingers. In this,
Okay.
if the swelling is quite large or swelling is small, we can place the fingers like means this one point on the other end, another point on the this, and like this we can just palpate the swelling, whether it moves or not. And sir, we have to do it in the both axes, perpendicular to each other, and check whether it is fixed to underlying structure. And sir, we have one time we have to move it when the muscles are relaxed, and the other time we can ask the patient to twist its muscle, and then we can move the swelling. So in this case, we can say that the swelling is fixed to the underlying structure or not.
One thing is that you said movement. Movement is mobility. So it's out of question. We don't check movement of the swelling. What we
Sorry, sir.
check
No
is,
fixity. Yeah, yes, sir. Fluctuation is
see,
different. Yes.
what you need to do is like, just a minute. What I'm visible.
Yes, sir.
Very well.
So what is important here is you need to check the fluctuation when the swelling is fixed. Okay.
Yes.
So there's no question of mobility or something. When you check the mobility, one finger is a pressing finger and other finger is assessing finger. Correct. So you press from one side, you will feel the impulse on opposite side, so your finger will get displaced. Correct.
Yes.
So this is the pressing finger and this is the displacing finger. You very correctly said that you need to check the fluctuation in two planes perpendicular to each other. Why? Why so? You said very correctly. I think this is the most common question asked in exams, for undergraduate exams or even for the postgraduate exams. And few students do tell the correct answer. Okay. So if you answer, the exam will be very happy. Anyone? Saurabh, if you are able to make out, what is it?
Not sure, sir.
You need to check for anyone in the audience like to answer this question.
Sir,
Uh,
it is perpendicular to
yes.
the underlying structure. So
Uh,
it
yeah.
moves along its
Can you
plane.
just elaborate why you need to examine the swelling fluctuation in the directions perpendicular to each other, two planes perpendicular to each other? Why?
Because
Uh,
if it
the-
moves along the direction, the underlying structure also may move along it. And when
Uh,
it
yes,
does not,
yeah, you're coming little closer. What happens is, if you check your quadriceps, what happens is sometimes a bulky muscle can give sense of fluctuation in the direction of the fibers perpendicular to the muscle, but you won't get that in the uh, direction of the muscles. Okay, so for example, if this is the direction of the fibers of the, just examine your quadriceps. Okay, just press from one side of the thigh, okay, and you will see the impulse on the opposite side, but just check the fluctuation in the direction of the fibers, it won't be there. I think anyone, most of you will be sitting in your home or something, you can do it yourself. Okay, press from one side, you will see the impulse on opposite side, but it's for the fibers along the direction of fibers, you won't get a fluctuation in the muscle. Got it?
Yes, sir.
Saurabh? Yes,
Yes,
I
sir.
think most of you will understand this, because see, fluctuation test is done to know whether the swelling is cystic, whether the contents are fluid into it. Okay, so it's not related to mobility; it's related to the contents. And you do a fluctuation when the swelling is soft in consistency. You have firm or hard swelling, fluctuation is out of question. Okay, so for a
Yes.
softer swelling, whether the swelling is cystic or not, in that condition you will do a fluctuation test. So to know whenever we call it as a fluctuation test positive, when we then the fluid content is the fluid inside. Okay, so
Yes, sir.
for that you do it. Okay, and what is Paget's test? If the swelling is too small, you are not able to hold in two hands or two fingers, what they do is like you press at the center. If the swelling is cystic, it will be soft at the center. Okay, that's called as a Paget's test.
Okay,
If
sir.
I'm not wrong, I think Nihar, if you correct it, huh?
No, sir, it's perfect, sir.
Yeah. Saurabh, you got it?
Yes,
Fluctuation
sir.
is something which is almost alternate or every third student is going to be asked in exams. Okay. So you need to be very thorough in your fluctuation. Don't confuse this with mobility. Mobility is something completely different. Okay.
Yes, sir.
Fluctuation is to know the content inside, whether it's a liquid content or not. When we call it as a pseudo, because sometimes fat is also going to give you sense of fluctuation, which is a false sense of fluctuation. That's why we call it as a pseudo fluctuation. Okay. But that after you see that slip sign, okay, which is a sign of mobility.
Yes, sir.
Correct? Yeah. Fine. So what you said was findings of inspection and confirmed. It's a
Yes.
firm and lobulated in consistency. It's not firm. It will be probably soft in consistency. Okay. Firm
Okay.
swelling is now. How do you call it as a what is soft, what is firm? Because it's all subjective. What you may feel firm, I will call it as a soft. And someone obviously we won't confuse with soft and hard, but definitely firm to hard consistency and firm to soft consistency may get confused individually because of it's a perception. So, any idea how to make it little easier to understand? Saurabh, can you make it?
Sir, the tip of the nose, if you palpate, it is generally called as firm, whether that's
Yes, very good.
forehead is generally
Yeah,
considered as hard.
very nice, very nice. Yes, okay. And the other one
Uh,
is
Soft.
lips. Lips is
Soft.
a soft.
Lips are soft.
Okay.
Yes, lips.
Yes. So lips, it's a forehead, it's a nose, and to the lips. Lips are soft in consistency. So always compare consistency because very important consistency. As you know, like a surgeon, or even during your surgical exams, this is the most important palpatory skills, which is your need to assess it. Okay. So the consistency, you shouldn't go wrong. Okay. You shouldn't call something which is soft as a hard or vice versa. Okay. So here, once you say the swelling as a firm, okay, so the or a hard, then you cannot have a fluctuation test applicable to it. Okay.
Yes, sir.
Sometimes, if it's a tense cystic swelling, sometimes it may give a swelling of a firmness or hardness. In especially these are the cases like polycystic kidney, where you send. But if you carefully examine, you will come to know that okay, the swelling is soft at the center. Okay, that's a Paget's test. Okay, that will help you to know that if the swelling is soft or not. Okay. Anyone wants to add something? Yeah.
Why did you specifically ask, why did you specifically check for skin over the swelling can be pinched or not?
Sir, to differentiate the swelling from other swellings, like to differentiate it from sebaceous cyst, in which the skin over the swelling is not pinched.
Okay. So basically anything which is arising from the skin, you rule that out. So this is, so what is your
Yes, sir.
inference here?
Uh, Sir, means I have ruled out sebaceous cyst, and now means I am thinking in case of lipoma.
Yeah. So basically you are coming to know about the plane of the swelling, so from where the
Yes.
swelling is originating. You have ruled out that you're pinching, you're able to pinch the skin, so it's not from the skin. You're able to move it over the muscle because the slip sign is positive, the fluctuation is there. Slip sign is positive basically. So it's somewhere. Where are you thinking the swelling could be?
Sorry, sir.
So what do you think now? Where could be the swelling? Because you are saying that there's no fixity to underlying muscle. The skin over the swelling is it's pinchable.
Sir, I am thinking this swelling is probably a case of lipoma.
Okay.
You feel it's in a subcutaneous plane. That's what. Neither it's fixed to skin, neither it's fixed from the muscle. So
Yes, sir.
the plane where it is likely to be the in a subcutaneous plane. Okay.
Subcutaneous plane. It is.
Okay. Okay. Uh, Okay, what is now you said pseudo fluctuation. What is cross fluctuation? Any idea, Saurabh? What is cross fluctuation? Anyone in the audience?
No, sir.
Hello, sir.
Yes.
Sir, in case of a large swelling which is connected, like let's say hydrocele, you can see cross fluctuation.
No. Yeah. More important, like a more good example of cross fluctuation is something called as a compound Palmer ganglion, where the ganglion is like the swelling travels. It's a fluid collection along the tendinous sheath, and you will have a some swelling from the say some part of the ganglion extending beyond the flexor retinaculum, above it and below it. So you will have the swelling which is connected, but you will see the two swellings. When you press one swelling, you will get a fluctuation or an impulse on the opposite side. You got it?
Yes, sir.
So that's called as like a cross fluctuation. Okay. So these two swellings are connected. Especially the classical example is compound Palmer ganglion. Okay, where you get this type of a fluctuation. Yeah, fine. No fixity to underneath muscle. You said like there is no tenderness. Okay, no local resonant pressure. Okay. Anything else? Slip sign is positive.
Yes, sir.
Which conditions you get slip sign?
So in cases of lipoma, we get slip sign in which there is a yielding of that swelling is not possible. When we press the swelling, it goes to laterally, and hence in
Okay.
yielding is not possible.
Okay. This is seen in lipomas. This is seen in fibroadenomas of a breast.
Oh,
Okay.
yes, sir. Fibroid.
Where the swelling slips out of our fingers. Okay.
Oh,
The mobility is such in a patients with fibroadenoma that we call it as what?
Mickey Mouse sign.
Yeah, mouse in a breast, we call it as. Okay. So it's like extreme mobility. Fine. Okay. Anything else,
Uh,
Nihar, you want to add?
Summary.
Maybe
Yeah.
you can tell us about the different swellings, peripheral swellings, and how to differentiate them.
Okay.
Just for the
Yes, sir.
sake of enumerating. Probably. Yeah.
So on the basis of history, we can differentiate some swellings like sebaceous cyst, which we can differentiate from other swelling that it is not associated with discharge. No swelling anywhere else in the body, no significant family history, brownish discoloration of skin, tinnitus, visual symptoms, tingling. It separates the swelling from the neurofibromatosis because there were many symmetrical swellings on right and left side. So I wanted to rule out that thing. To differentiate it from malignant swelling, I have read no history of rapid increase in size of swelling, no history of significant weight loss, anorexia, fever, no history of not associated with tingling sensation, and not associated with edema.
Okay.
Yes.
What about
What makes it
ganglion?
like? Okay.
Sorry.
Yeah,
Yes.
ganglion. Yeah. Continue. Ganglion. Yeah.
What? In which where will you consider this differential of ganglion? Is there any specific site to it?
Sorry, sir.
What about ganglion? It can it be ganglion?
Not sure, sir.
Sir, ganglion may be beneath the fascia, sir.
Yes.
Beneath the fascia, related to some joints, because
Yes.
it arises from the synovial membrane. So
Correct. Yeah. So it will keep on changing as per the flexion and extension of the joint. Yeah, very nicely. And even the mobility won't be there like what we see in a lipoma, because obviously it is related to the tendon sheaths and joints. So we'll have a restricted mobility of that ganglion. Fine.
Right. So you are asking something.
Why you like? What are the features which make again? We will go back to our first question. What are the features? Suppose this turns out to be this is a benign swelling. So, what are the features of malignancy which are not there in this patient?
Sir, there is on history and
Yeah,
examination, we can have some different features. On history, we can see that there is no history of rapid increase in size of swelling.
correct. Hmm.
Systemic features like no history of significant weight loss, anorexia, and fever. And to check for
Okay.
neurovascular invasion, we can see there is no history of tingling sensation or no history of edema for lymph node involvement.
See, like if it's a swelling is a sarcomatous, na? What will happen is where the lipomas are prone for malignancy in which regions? Lipomas are usually benign swellings, most of them. But at some sites, they are notorious to be have a malignancy, which are the sites, Saurabh? It's on the back or retroperitoneal, okay? Sites where the lipomas are known to have a malignancy, okay? So
Okay.
these are liposarcomas. So sarcomas won't metastasize through lymph nodes. There are few exceptions to it, but for practical purpose, sarcomas metastasize through blood. They will won't go into the carcinomas, go to the nodes. Okay. So you
Okay, sir.
won't get a node or something positive here. One, as you said, rapid rise of uh, increases history is very important. On local examination, what will happen is uniform smoothness of a swelling will be lost. You
Yes,
will
sir.
have a varied consistency. You may get some hardness, some
Yes.
firmness. Okay. And very important is loss of mobility.
Yes, sir.
Okay. The swelling may get fixed somewhere because malignant tissue is known to invade surrounding. Okay. There will be local
Yes, sir.
rise of temperature because of the increased vascularity.
Yes.
So you may see on inspection some dilated veins. Okay. No, always take dilated veins or the swelling with a pinch of salt. May it be in a breast or anywhere. Okay. That could be a sign of a malignancy. So, in or increased vascularity. So, any local vascularity, any mobility, consistency, and fixity. Okay. This will give you some idea whether it's a any possibility of a malignant swelling.
Yes, sir.
Yeah, fine. I think. Anything else? I think, Nihar? We're done.
Yes, just when if this would have been a malignant swelling, what do you think would be painful or painless to begin with?
So initially, the malignant swelling would be painless, and later the malignant swelling, if it is infiltrating in nerves or a secondary infection is happening, it can be painful.
Any other causes of pain in a malignant swelling or any swelling for that matter?
Hemorrhage, bleeding.
Necrosis is one other cause. Hemorrhage, secondary
Um,
infection, as you mentioned. Yes,
Sorry, it could be due to straightening of the skin.
right. Touching of the skin or the capsule. No, that's correct. Great. You can continue, Saurabh.
Okay.
Summary.
Yes, sir. Anything
Sir.
else, sir?
No, I think should be fine. Yeah.
Yes.
So should I continue with summary?
Yes. Yes. Hmm.
35-year-old male with chief complaints of swelling since 4 years on both sides of forearm, four swellings on left side and three on right. Largest one was initially of size 1 into 1 centimeter, which was gradually progressed to size of 4 into 4 centimeter in 1 year, present on right forearm. No change in size since then, not associated with pain. On examination, swelling of size 4 into 4 centimeter with well-defined margins, which was soft and lobulated in consistency, with slip sign positive, pseudo fluctuation present. Probably this is the case of lipoma, and the patient is probably suffering from lipomatosis.
Like this swelling has a lipoma and multiple lipoma. Okay,
Yes, sir.
lipoma to swelling. Okay, should be fine, I think. You will
Where else
require
is
any
it?
investigation? Yeah, sorry.
Just last question, sir. Why is it known as a universal swelling? Where else can you find it other than the
Yeah.
other
Sir,
than skin?
it is also known as ubiquitous, means it is the swelling which is present anywhere in the body. Uh, so that's why it is called as universal swelling.
Where do you find it other than the skin?
So,
Or do you find it in GIT or maybe respiratory tract?
so we can say it in retroperitoneal space.
Okay.
Mhm.
There's so many planes, like you will have intermuscular, as Dr. Nihar is saying,
Yes. Yeah.
subserosal, submucosal,
Yes, yes, yes.
subperiosteal. Okay.
Mhm.
So many a times if it is present submucosal, subserosal, it can even cause intersusception in GIT because that acts as a leading point for the intersusception. If it's present in the trachea, it can cause respiratory obstruction. These are certain points, the important rare points about lipoma.
Fine. Yeah.
Yes.
One very important for all students is we're discussing ulcer and swelling. So you need to be versed with a brief anatomy of the foot or the swelling underneath muscles and bones. Okay, because the questions asked are that which muscle lies underneath. Okay, so suddenly you fumble in between because you get blocked because अरे कौन सा muscle आता है, because you learned your anatomy in first year and suddenly you are asked in a final year exam यहाँ पे कौन सा था फ्लेक्सर एस्पेक्ट पे प्लांटर फेशिया था उसके नीचे का टेंडन कौन सा है. So suddenly you get confused into it, and probably because what happens is you appear in like for daily 25. So examiner is taking exam for what, 1 day, 2 day, third day, fourth day. So fourth day they start asking some weird questions. Which what is the initial, maybe the as per the format which you are discussing. So be prepared for some weird questions like some anatomy, or sometimes what happens is the history or sometimes it deviates completely to the different day. You ask for that patient has no urinary difficulty, and suddenly you have a case of some lipoma, and then the urinary difficulty your viva goes on a prostate, symptoms of prostate. So all cases, maybe it be ulcer or swelling, they are just to initiate the discussion. You viva may sometimes deviate randomly at sometimes topics which you are not given a thought. So you need to be at least prepared with a local anatomy, okay? So that will help you sometimes to know that because these questions are asked. Okay. Yeah.
Yes.
How you manage this, sort of?
Sir, first of all, I would like to, sir, lipoma is basically a clinical diagnosis. But just to confirm my diagnosis for medical legal purpose and for records, I want to do some certain investigation. I will do some routine investigation and some diagnostic specialized investigation. Routine investigation, I would like to perform complete blood count, red blood cell indices. For specific investigation, I would like to do ultrasonography. Then I would like to do MRI. I would like to do FNAC, fine needle aspiration cytology or biopsy. If the lipoma is asymptomatic, I would like to continue conservative management for this patient for to wait and watch and ask him to come for follow-up. If the swelling is quite large and there is rapid increase in size, there are some cosmetic problems with the swelling, and if the patient is willing to remove the swelling, I would like to do excisional surgical excision of that swelling, excisional biopsy.
Okay. You need not take a FNAC or biopsy if it's like a subcutaneous, purely subcutaneous tissue, by and large. Okay. because it's, as you said, purely clinical diagnosis, unless you are suspecting malignancy or something. And where possible, you do excisional biopsy. You won't take a small incision or a true cut biopsy and later on do for a lipoma, which is completely clinically benign swelling, and most likely even post-op also you are going to see the same. So
Yes,
I
sir.
think, yeah, fine. Biopsy or FNAC, you're suspecting something. You're like any mobility restriction, or you're suspecting on a like a malignancy in somewhere.
Yes, sir.
Otherwise, not. Yeah, fine. I think Nihar, you want to add something? MRI is also not required routinely for a
Yeah.
subcutaneous swelling, but MRI or as you said, like further analysis, ultrasound, especially important where the depending on the area where you are doing it,
Yes.
especially if it's in the neck or something, where you need to visualize extent of the lipoma going somewhere you are not sure. But for a peripherally situated small lipoma, probably you won't require even a lipoma also. Sorry, MRI also.
Yes.
Yeah, fine. Yeah. Any questions from audience, or you want to add something? Is audience there or सो गए कोई क्या खाएगा नहीं?
No, they are there with us, sir.
अच्छा, okay,
Almost
okay.
85% of those who joined initially are there with us, sir.
Nice, nice. Yeah. Probably, as you said, like most of them are undergraduate students who will be appearing for their university exams. So probably, if this is the format, probably you are done. You have gone through. You are done. Probably good. This type of answer. Okay. So be prepared for some simple questions. Don't make a mistakes in common concepts like a fluctuation, mobility. Okay, fixity to skin, extent of the swelling, dimensions of swellings. Okay, so where you shouldn't allow any like, did you perform a transillumination here?
No, sir. As the swelling was small, I did not perform transformation test.
Okay, so which swellings are transilluminant?
Sir, swelling like large swelling which hydrocele. Uh,
Yeah, correct.
sir, brachial cyst. I'm not sure.
Branchial cyst, yeah, branchial cyst,
Brachial
yeah, correct.
cyst.
Where it is located? Very nice answer. Branchial cyst, where it is located commonly? Branchial
Sir,
cyst
on
and branchial. Hmm.
posterior triangle of neck.
Yeah, in relation with sternomastoid, but there is some fixed relation with the sternomastoid. Any
Yes.
further details you can give? Where in the posterior
Uh,
triangle?
Not
Or
sure,
it's
sir.
uh, anyone from the audience? Because
Sir, it is the anterior border of sternocleidomastoid, middle one third.
yeah, it's a junction of say what you can say exactly. I think upper one third and lower, like lower two third for a swelling. And if it's a fistula, the branchial fistula, which happens if the swelling is related with the upper two thirds and lower one thirds. Okay, near I'm correct.
Yes, sir.
Yeah. So the ones the improperly excised fistula, you will see the fistula at the upper side, but the natural congenital branchial fistula or branchial sinus, we call it as, is usually located at the junction of the upper two third and one lower one third. Okay. So swellings, they are also transfilament. Correct. Any other swelling which is transfilament apart from branchial cyst and hydrocele? There are plenty. Meningocele, you know.
Yes, sir.
So meningocele, you have heard of meningocele?
Yes, sir. Yes.
So where this located commonly, meningocele? It's a congenital swelling. So this is a very common
Uh,
question asked. Like it's a congenital swelling,
Spine, back,
which is usually where in the
lower
spine.
part of the back, spines, back,
Yeah, lumbar. Yeah,
lumbar.
Mm, yeah. So like it's a lumbar part, lumbar meningoceles which are common. They are also translucent. It's basically defect in the vertebral arch. So it leads to herniation of meninges or protrusion of the meninges, which contain CSF fluid. Any other swelling which is brilliantly translucent, brilliantly.
Sir, cystic hygroma.
Yes, say very good. Cystic hygromas. Yeah, cystic hygromas are
Epi,
brilliant transluminant. Then,
epididymal cyst.
yes, very nice. So cyst of epididymis.
Um,
Okay. Yeah.
Sir,
So these are like brilliant. One of the transluminant swelling is ranula.
ranula. Okay, yes.
What is ranula? Then,
So ranula is a benign swelling which is present at the base of the tongue, base of the mouth.
but from
Uh,
arising from what?
uh,
It's a extravasation cyst arising from the
extravasation cyst. Yes.
it's the classical. You know the how to classify retention cyst, extravasation cyst. Okay.
Yes.
So what we call it as here is like extravasation. It's because of the extravasation of the secretion of the sublingual gland. Okay. So it's from
Yes,
the
sir.
floor of mouth, correct?
Yes, sir.
And then what is plunging ranula? Plunging
Uh,
ranula is a sublingual swelling because
Sir,
sublingual.
involving submandibular gland is
Yeah. So extension from the sublingual to the
two submandibular.
submandibular space, which happens. Okay. So
Yes, sir.
that is called as the plunging. So actually the origin of the swelling is at the floor of the mouth and it extends into the neck. Okay.
Yes,
So
sir.
that is called as a plunging granula. Okay. So that also is a transluminant swelling.
Yes,
Correct.
sir.
Okay. Yeah, fine. So I think transillumination is one thing, mobility, fluctuation, transillumination. Okay. I think pulsatile is the swelling. How do you check for pulsatile swelling or not?
So swelling can be transmitting impulse and
Very good.
there are
Yeah.
expansile impulse. There can be two type of impulses in a
Okay. So
swelling.
how you
So
differentiate between the two?
we have to place two fingers on the swelling. If
Hmm.
the swelling is
Yes.
transmitting, the two
Yes.
fingers will get slightly lift. But the swelling
Okay.
is expansile swelling that the two fingers will get lift as well as will separate
Yes.
from each other, means like this.
Okay. Yes. Fine. Fine. So if it's expansile, then we call it as aneurysm.
Yes, sir. Anyways.
Okay. Or a very vascular tumor also can become like a behave like expansile, but it's more for restricted for aneurysms. Okay.
Yes.
And the other one is if it's a aortic aneurysm and a node sitting on the aorta. So as you said, like if it's a aneurysm, the two fingers will separate.
Yes, sir.
But for a node, the both the fingers will get elevated and won't be separated. Or other is you make patient on a knee elbow position. The swelling will
Hmm.
fall away from the aorta node, and maybe it will lose the pulsatility. Correct.
Okay, sir.
Very important is for the swellings. Again, one more aspect to be discussed was reducible swelling and compressible swelling. Can you know what
Yes,
is
sir.
reducible swelling? Yeah,
Uh, Sir, when the size of swelling decreases when we apply an external pressure to it, it is known as the
correct.
compressibility. And when we remove the external force, the shape of the swelling came back to its original shape.
Okay,
Reducibility is when we apply external force on the swelling, the size of the swelling reduces. On removing the external force, the size of the swelling does not get its original shape. And it also signifies there is an underlying defect in case of reducible swelling.
okay. So example of a compressible swelling,
Um,
an example of reducible swelling. So as you said, reducible is
Sir,
unless the opposite force acts,
yes.
it won't come back. So classical is hernia.
Hernia, sir. Yes, hernia.
You press the swelling, and if the swelling is reducible, it goes down. And unless the patient coughs out, so that gets again come back to the swelling. That's called as a reducible swelling. As I
Yes, sir.
think one has answered is all vascular swellings are compressible swelling because both get reduced in a volume. Okay,
Yes, sir.
so vascular swelling. Can you give example of vascular swellings?
Sir,
Classical is hemangioma.
hemangioma. Yes,
Hemangioma. Okay.
yes,
So there will be sign of emptying. What we call it as an hemangioma. You keep on pressing, the swellings become compressible, reduces in volume. Lipoma is not a compressible, classically compressible swelling. It yields to touch. Okay,
Yes, sir.
but doesn't reduce in a volume.
Yes, sir.
Okay, you got the point. Always you need to know that whenever there is a compressible swelling, you will see that it is a sign of emptying gradually. And once you release your finger gradually, depending on the blood supply, it sometimes can regain faster or slowly. If it's a capillary hemangioma, slowly the swelling refills. Okay.
Yes, sir.
So that's why sometimes there are a lot of, with all modern investigations, everything okay. But what sometimes error happens is sometimes they are labeled as abscess. They are local rise of temperature. They have tenderness sometimes, and you may get a false sense of fluctuation, and you do try to drain it in a minority or something, and ultimately you come to know that it's a hemangioma. Okay,
Yes.
but uh, that is a disastrous thing to know that after incising that it was a hemangioma which you have misinterpreted as abscess. Okay, so it's a very important sign of emptying or compressibility. Okay, so I
Yes, sir.
think that should complete. Any other point which you feel you need to add into it is
So we
near?
have almost finished everything, sir. Everything
Okay.
regarding swelling we have discussed. Are there any questions from the audience they want to ask? In swelling, surprisingly, no one has asked me yet.
Excuse me, sir.
Sir,
Yes, Namrata,
Yes.
maybe.
Yes.
Sir, dermoid cyst is also compressible, no, sir?
Yeah. So what you said, na, it yields to touch. What, like few books, this is a gray area. What you call it, the compressible swelling, is like a classical hemangioma. Now here it yields to touch.
Okay.
Okay, like you
Just like
press
hypoma.
some part of the lipoma, it yields to your pressure and you get removed. It comes back, but it never reduces in a volume, basically.
Yes, sir. Yes.
Yeah, so that is few clinical textbooks are given it as a compressible, but just for a principle, you should know that classically emptying, signs with the emptying is, you can add that sign of emptying if you are asked in exam. To be specific, sir, sign of emptying is there, not there. Okay, very good
Okay, sir.
question. Okay, and dermoid for you said na,
Yes.
Saurabh, can
Yes,
you
sir.
differentiate us dermoid from lipoma?
Sir, in case of dermoid cyst, we can see there would be fluctuation test would be positive.
Yeah, even lipoma is pseudo fluctuation, so fluctuation is
Uh,
positive there also. So, for example, I give is because
okay.
dermoids are classically seen at normal
Sir,
like
ED of
midline
swelling.
or peculiar signs of
Yes,
fusion,
yes.
like post-auricular, classically. Okay, they so
Outer canthus of
suppose
eye.
it's a swelling over the scalp. If it's a sebaceous cyst, it will be fixed to skin. Correct.
Yes, sir.
But if it's a lipoma or a dermoid, can you differentiate between the two? Because both will show uh, soft in consistency. They will have fluctuation.
So
Okay.
the yielding of the swelling will not be present in lipoma, but will be present in dermoid cyst, which we can also see.
Uh,
Slip sign is present in lipoma, but will be absent in dermoid cyst.
may not be okay. That is classical, but sometimes you may see a mobility even dermoid also. So classical,
Okay.
and you may not get a classical slip sign in lipoma sometimes. They are
Okay.
mobile. Anyone wants to add?
sir, transillumination test?
Yeah, so if the content is transparent enough, okay, some, because most of dermoid may not contain a clear fluid. It's a mix, dermoid may contain, depending on the type of that dermoid, okay, may contain the different materials, okay. So most of the times, if it's not clear cystic fluid, like if you carefully palpate the skull, you will have bony indentation. You will see a depression in the bone, which is not there in a lipoma. Okay, so that bony indentation is a sign which will give that probably this is a dermoid tumor. If you slightly displace the swelling and try to fill the skull beneath, you will see a slight defect in the skull. Okay,
Okay, sir.
slight depression in the skull. So that bony indentation is a very classical sign that this is a dermoid. Okay, And that's why dermoid needs further investigations because sometimes it can have intracranial extension. So you need to do a CT or something for that.
Excuse me, sir.
Yeah,
Sir,
Namrata.
communication of dermoid cyst with the underlying meninges also, no, sir?
Yeah, that's what I'm saying. So that's why you will get a bony indentation or a defect. If you carefully palpate, slightly displace the dermoid, and you will see that there is a bit of a depression in the bone, which won't be there in a lipoma or sebaceous cyst.
Yes.
Okay, this is pertaining to skull, especially to the skull, because it related all three swellings are related to skull.
Okay.
Okay, yeah.
Yeah.
Anyone wants any query?
There is one question. Is blanching an important sign in swelling?
Yeah, blanching. Yeah, anyone like Saurabh? Anyone wants that? Blanching, you want to say like? Can you elaborate what you want to see? Because it's typically for vascular swellings. Okay.
Viroshan, if you can mute yourself and maybe ask the query.
Blanching is typically seen in patients with varicose veins with telangiectasia. Like telangiectasia is what? Like enlargements of small or capillary vessels, especially at the ankle. You press them, they disappear, and then when you remove them, they reappear. Okay, so something called as a blanching for certain AVO malformations. Okay, so that may become more prominent. Okay, there's some question asked, right?
Yes,
Yeah.
sir. So the question is blanching an important sign in AVMs and hemangiomas?
Yes, yeah, definitely, yes, fully agree. Okay, anyone else wants to add? Because swelling is something, as we initially discussed, swelling is a base of most of the swellings which you are going to get: lump in abdomen, maybe varicose veins, maybe some sebaceous cyst, thyroid. Okay, so anywhere a swelling, lymph nodes, so you will get a swelling. So you need to be so for example, you are asked for like a lymph nodes, you will be asked like what are the level of nodes. Sometimes your Viva may go on what is radical knee dissection, what are the things, because even at undergraduate levels they are asking these questions, which structures are commonly removed during radical knee dissections. Because as you said, as we're discussing, because you are appearing daily for 25 students, you will never expect like a typical format questions pertaining to that case only. So you need to be prepared to answer bit of questions in and around the swelling. Okay, fine, I
Right.
think.
So last question is, can dermoids have cuff impulse positive?
Dermoid, sometimes if it's an intracranial extension, if the content is fluid, you may get something like a occipital meningocele or meningocele, something like that. But most of the dermites do not give any cuff impulse positive unless it has any swelling which is related to spinal canal, cranial cavity, thoracic cavity, or abdominal cavity. With the connection inside, will give cuff impulse positive. Okay. So if the content is liquid, you may get if the dermoid is well connected. Yes, ganglion cyst also can show transformation positive. Yes, correct. Any other, because a lot of good questions you're asking. Okay, chalo, nice.
Great. I think we can
Yeah,
end on swelling. Thank you so much, Saurabh. I guess